Welcome back. You watch Morning Live. Now, the focus might be on breast cancer during the month of October, but the leading cause of cancer deaths in women is cervical cancer, and according to medical experts, it can be prevented. One of the ways of dealing with the scourge is a simple but misunderstood medical test called a pap-smear. While many of you might not understand what it is or how important it is, our producer Tumi Sedumedi paid Obstetrician-Gynecologist Dr Johannes and asked all the questions women need to answer to find out about a pap-smear. Let's take a look.
Dr. van der Vaart, for the benefit of anyone who doesn't have an idea, what is a pap-smear?
We can say that the main purpose of a pap-smear is screening to look for precursors of cervical cancer. So if you do pap-smears regularly on a population of women, you will find that you will, for practical purposes, almost eliminate cervical cancer, because you can sort of do procedures to stop it developing into cervical cancer.
What exactly is cervical cancer?
Cervical cancer in South Africa, as far as I know, is the commonest cause for cancer deaths in women. And it is basically a cancer that occurs in the mouth of the womb, that is the cervix. That's why we do pap smears, because you can actually pick up precursors of the cervical cancer, and then with simple measures stop it developing.
When a woman comes to you for a pap smear, what practically and actually happens?
It is an awkward test, because you have to use this thing, it's a speculum, to look inside the vagina. And then we visualize the cervix and we wipe over the cervix with this brush. And what then happens is the cells from the cervix clings to the brush, and then nowadays we put it in this bottle, and then we send it to the lab, and then the lab sends a report to us. And then the report can either be normal, or they might report abnormal cells, anything from a range.
So doctor, if the results return unclear, what's the worst case scenario?
The worst case scenario is if they remember, a pap smear is not a diagnostic test. Mm-hmm. It says something looks like something, but if a pap smear is abnormal, mostly you have to do a further test depending on how serious the finding is. But the range can be from atypical cells, mild, just slight abnormality, where you would mostly not pursue it immediately and rather do a follow-up. Very often it clears spontaneously. Or it can be more serious, where the lab would recommend that we do a microscopic examination of the cervix and take a biopsy, which means we take a piece of it and send it to the lab for analysis. Or the worst scenario, if a patient, for instance, didn't do pap smears regularly, they can even report on it that there's already cancer.
And if the results do return unclear, but it isn't the worst possible scenario, what do you say to the patient? How do you put them at ease?
They talk about atypical cells of unknown origin, or in the past we spoke about SIN, but it's a low degree lesion. It's classified low degree lesions or high degree lesions. But remember, the pap smear only says it looks like that, it doesn't give the exact diagnosis.
What would you say to advise a young woman about pap smears, and when would you advise them to start going for pap smears?
The advice is that once a patient becomes sexually active, then we would start doing pap smears. And we would mostly say start about 6 months after you start being sexually active. How often is not so clearly defined. In South Africa, we tend to recommend it annually, but maybe that's too much. Maybe if, for instance, if your first pap smear is normal, you might wait 2 or 3 years before you do another pap smear. But obviously, if there's abnormalities on the pap smear, you will more often check it.
So what is the ultimate aim of a pap smear, doctor?
The advantage of this is, if you can pick it up before it is cancer, you can, with a very simple, non-invasive procedure, stop it developing into cervical cancer. Pap smears are extremely effective. For practical purposes, you can eliminate cervical cancer in a population of women by starting pap smears early and doing it regularly.